Community Heart Media. Your voice, your heart, your opportunity. Welcome to tonight's show.
Good evening. It's Community Heart Radio tonight, and we've got a special show, another special show, tackling a big issue that's gone really berserk over the lockdowns and the COVID stuff, which is the topic of anxiety, Julio. And I know you've been suffering a lot from anxiety, mate, and hopefully tonight you'll get some help here from some great professionals and some great discussion.
Yes, I'm looking forward to the discussion about anxiety, especially now and this time, and also, with my friendship group that I've got and what they've caused me with anxiety during the last couple of months. So we'll go from there and see how we go.
I do reckon, Kelly, that every one of us, it's good to see you tonight, Kelly, too. Every one of us has a little bit of anxiety around a whole range of things. Do you think that's true? Do you get a bit of anxiety?
Yeah, I definitely think it's true. I think for me, what I am definitely identifying with at the moment is around health. I'm quite anxious in terms of, the COVID situation and my health and the detriment and effect that the other health conditions that people have and the effects that are being placed to prioritise COVID health over others. That's my anxiety at the moment.
Yeah, there's a lot to unpack tonight, and we've got Molly May. She's a youth ambassador with Big Brothers Big Sisters, the Youth Are Not Alone project. Molly, it's great to have you here on Community Heart Radio.
Thanks for having me. I'm quite excited to talk about this topic tonight.
Yeah, we're very excited to have you here. And Dr. Peter Wright. Peter, it's great to have you here, and you're from the First Step program. A lot of experience. It's great to have you here on the show.
Thank you.
Thanks for joining us tonight. Peter, we might start with you. You're a doctor. Must be a lot of pressure on doctors with the pandemic and COVID and all that, mate. How have you coped with the last few years being a doctor?
It's certainly been different. You could never have foreseen. If 3 years ago you told us that we were going to be doing the strange things that we've been doing in the last 2 years, nobody would have believed you. I very much had to fall back to my training, and I have to believe that the application of learning and experience and processes, if you follow them, can lead you to a good outcome. That you have to just stay calm and do what you've done before, but at the same time also innovate to new situations.
100%
Sure.
agree
Tell us
with
a
you,
bit
Peter.
about where you're from, Peter. What's your context? I know you work at the First Step program. What's that all about, and what's your role there?
I'm a GP, a general practitioner. I've been at First Step since 2013. It's a primary care service that has a special interest in mental health and addiction. It also is unusual in that it's co-located with a community legal practice, which I believe is that situation is the only one in Australia. It also tries to work in a multidisciplinary fashion with psychologists, mental health nurses, social workers, case managers and counsellors to deliver a broader package of care to patients.
Sounds very needed in COVID. Now, Molly May, you're a youth ambassador with the Big Brothers Big Sisters program. Tell me about what tonight's all about, the Youth Are Not Alone project, focusing on anxiety. What's going on here?
Yeah, so we are starting up a podcast. So this is kind of a platform we're using to record the podcast and get a bit of it out there into the world. But the podcast is named Mind the Gap. So we're bridging those gaps that the youth, we believe there are some unanswered questions out there. So we cover a couple topics like our last episode that we recorded last week that you can find on the Community Heart Facebook page, covered loneliness. And so we're bridging those gaps. And tonight's topic will be about anxiety, so covering some unanswered questions and so just bridging those gaps about this topic tonight.
And Kelly, it's a youth-led project. Molly's one of our ambassadors leading this project, the Mind the Gap project. So it's pretty exciting, don't you reckon, to have a young person leading it? And
I think it's so important, because especially youth leading youth, then you can relate, you can understand, you can place yourself in their own shoes as well. And as a former allied health professional myself, I completely agree with Peter, needing that multidisciplinary approach. And often, when you're working with youth, you've got to have someone who is understanding, empathetic, can be innovative as well, and can place themselves outside the box.
Yeah, for sure. Well, we've got a couple of people who've said hello already. Milton has said hello, which says, g'day, Milton. Thanks for joining us tonight. And James Nolis has said g'day too. James, thanks for listening tonight. And it's great to have you guys listening and others listening. And if you've got any questions, please put them in the chat or any comments. I'm sure we've all experienced anxiety to different degrees. It is a major issue, Peter, wouldn't you say, in our society? Anxiety, it's quite common.
Oh, it's utterly a very common experience, and it causes enormous distress. The feeling of being anxious is a very noxious, nasty feeling that eats away at you when it's there.
Yeah, and do you think the pandemic sort of has brought it on even more?
Oh, undoubtedly. One of the things that makes anxiety worse is when you feel that you don't have control over the situation. And that is exactly what we lost in the pandemic. We were restricted in where we went, who we could see, what we could do. And we also didn't have control over the normal things that we would do to keep us healthy. And so there was an enormous sense of things being out of kilter or beyond the normal control that you have on your life.
Yeah, I think we can all relate to that lack of control. Not allowed to go out after 9 o'clock, not allowed to leave our home 5 kilometres. Not be able to go to work, not be able to do this, not be able to do that, no be able to go to anyone's place. Molly, you would have found it a bit anxious being a young person, wanting to see life and got all this life about you, and for 2 years you haven't been able to do anything.
Yeah, no, definitely. I went through, still going through the pandemic. When it first began last year and all the lockdowns, I was in year 12. And so I've just finished my first year of uni. And, losing that social interaction, and people are saying like these are the best years of your life. It's also finding those new pathways and like how to enjoy the years as well, and how to interact with your friends. So, transitioning to online and everyone's going, it's not the same, but you're going, but this is all I've got. Like it's very confusing. And yeah, I guess as humans, we don't like change. It is very abnormal for us and it's uncomfortable. And I guess that's where like the anxious feeling for me came from for those years.
And I suppose, why did you guys choose loneliness and this the Gap podcast series? Why did you go down that road for?
Oh, well, we just feel like there was a couple topics that are not explained well enough within society. Obviously, we've got social media and there's platforms like TikTok, and that can spread. It's hard to get education from, a formal education system and then an informal education, which is social media. And then you're comparing the two and going, not everything's lining up. So we're kind of bridging the gap between the two, I guess. There's more of a social platform like social media, Instagram and TikTok, talking about, mental health and body image and all those things. And then there's a formal side of education saying, stress is really good for you and it use it to your advantage, but it's not really talked about like the damage that it does, or anxiety or anything like that. So yeah, bridging those gaps between those two worlds.
That's so great, Molly. And what do you think, the both of you, Peter and Molly, with these podcasts you're hoping to achieve?
Well, with the podcast, I guess we're trying to create a more balanced, like informative platform that people can come to. So we're getting, youth to run host the podcast. So we've got already our preconceived ideas of what the topic is going to be about and our questions. And then we've got a professional coming in like Dr. Peter Wright here with the educational side of things. And so we're meeting in the middle and,
Brilliant.
spreading, information that way.
And I love it as well. Like one of the comments here, James Nollis has said, it's about confidence too. Peter, do you think that this COVID situation has not only created anxiety in youth and amongst everyone, but knocked everyone's confidence about?
Yes, because the things that used to make us feel good, the things that used to give us purpose, the things that gave us structure were just not available.
Yeah, it's Daniel. It's great to have Daniel joining us tonight as well, and I'm sure he's looking forward to the podcast. Look, I think it's. Do you think people are going to recover, Peter? Like coming out of lockdown, what's the transition going to look like for people? You reckon?
I have to believe that people will recover, and I do believe that, Mark. People are endlessly resourceful and resilient. Sometimes they just need a little bit of help.
Yeah, true. Now, look, everyone, we're on the Community Heart Media Radio tonight, and it's great to have you here. We're going to be going soon into a podcast for the Youth Are Not Alone project, and led by our youth ambassadors. So we're going to be handing over to Molly soon. So, Molly, how are you feeling about running your first podcast? It's very exciting.
It's exciting. It's also a little nervous. So, good experience.
And you've got the great man Julio here to back you up technically. Julio's all get set, mate. We're going in about 3 minutes.
That's true. It is. In 3 minutes' time, we'll be on our way through a podcast. So
it's good, isn't it? I think it's fantastic. And do you think young people listen to podcasts, Molly?
Yeah, I definitely do personally. I know a couple of friends, we listen to a wide range of podcasts, audiobooks as well, makes it easy. And we've all got our P's, well, not all of us, but a lot of us have just started driving. So connect to the phone, listen to your podcast, driving to work or driving. So I love it.
What about for us older people, Peter? I'm not saying you're as old as me, mate, but are you into the podcast as well?
Yes, I love the opportunity not to waste time when driving, to be able to dip into a podcast. I think is a great use of time that otherwise might just be spent swearing at other drivers.
True.
Well, no doubt, Kelly, you'd be a podcaster.
Absolutely. I completely agree with Peter. If you're driving, I'm like, I'd rather be multitasking. If I'm sitting here working from home, if I'm driving, if I'm cycling, if I'm running, why not have something on in my ears as well?
And does that stop you swearing at other drivers as well, does it?
Absolutely, it does. It's actually a good deterrent, to be honest.
What about you, Julio? What stops you?
Me, I listen to podcasts. I've got my own little range of things I go listen to. I'm a pretty boring podcast listener. I like technical stuff, so that's me in a nutshell when I'm driving. Sometimes I want to make it longer, maybe drive around the block a bit longer and not get too enthusiastic on what I'm listening to. But yeah, pretty.
All right, well, we're going to head off soon, but I don't know what you've done to James Nollis, but he says you're a legend. So there you go. That's
technical
fantastic.
expertise.
A big Julio fan out there, and I'm going to leave this. I'm going to leave the show to two legends, Dr. Peter Wright from the First Step program, and Molly May, a youth ambassador with the Big Brothers Big Sisters program. Take it away, and it's really fantastic to have you two involved in this podcast.
Welcome to the second podcast episode of Mind the Gap, brought to you by Yana, Youth Are Not Alone program. Mind the Gap podcast aims to bridge the gap in knowledge that formal education may have missed and create an inclusive community that is a safe space for people to learn and grow, with your host Molly May, discussing with her guests the topic of anxiety.
Thank you for tuning in to Mind the Gap podcast. Today we will be discussing the topic of anxiety. But before we start, I would like to acknowledge the traditional owners of the land. I'm coming through to you from the Wurundjeri land. I would like to pay my respects to the elders past, present and emerging. Always was and always will be Aboriginal land. Hello everyone. My name is Molly May. I will be the host for this episode of the Mind the Gap podcast tonight, and I'm accompanied by Dr. Peter Wright. Thanks for being here, Dr. Peter Wright. How are you going tonight?
I'm very well, thanks, Molly. I hope you're well too.
I'm very well, thank you very much. I'm super excited to hear your insights on our topic tonight. But first, do you want to give us a little background about yourself?
Well, I'm a very fortunate person in that I chose a job, and a job chose me that has at its base the principle that if you apply learning and knowledge and experience in a systematic way, you can help people with significant problems. As a doctor, sure, it's about curing disease, but I also strongly believe that a doctor should seek to reduce suffering for their patients. At the start of my career, general practice was a great forum for this, but as I progressed, I realised two things fairly prominently. That there were processes and systems and treatments that were well documented and well established that addressed mental health and addiction issues, but which weren't available or being used for the majority of patients. And I also realised that to further explore and implement those strategies and treatments and processes, I should look to step outside the usual formula of 10 to 15 minute medicine, one person in a consultation. And I was so lucky and fortunate to find First Step, where we have a multidisciplinary team, and we are just a little bit able to step outside the model of 10 minutes on your own with one patient, and you can make an effort to build relationships with the patient and to build relationships with the team treating the patient.
Yeah, no, that's super interesting. It definitely sounds like you're the right guy to be speaking about this topic tonight. So just to introduce the topic, we are talking about anxiety for this episode. So to kick us off, Dr. Peter Wright, what is anxiety? And as a society, do we have a misconceived idea of what anxiety is?
Anxiety, I think, is a symptom. It's not a disease or a disorder. What makes the experience of anxiety a disorder is when the degree of dysfunction that it produces for the patient is unacceptable or impairing. When that dysfunction either changes how you act or how you feel about yourself.
And
everyone,
continue.
Everyone has the potential to feel anxiety because it's very strongly related to processes in the body that are there for a very specific purpose of increasing mental and physical abilities to address an important situation. But sometimes the body overshoots the mark, and that feeling of alertness, of importance, of the need to react turns from being a positive feeling to a negative feeling that drags you down. And that is when anxiety becomes a disorder.
Right. And so, are there different types of anxiety?
I think it's fair to break anxiety down into three main groups. There are people who live a life where everything makes them anxious and feel bad, and that would be classified as general anxiety disorder. And there are other who have a strong experience of specific things, people, animals, or objects causing anxiety, and that's best described as phobic behavior or phobias. And there's a third main type of anxiety, and that is when you become concerned about how other people and other institutions in society view and judge your behavior. And that's another sort of anxiety called social anxiety. And that can be very crippling. There is also the addition of panic disorder, which refers to the episodic experience of intense anxiety symptoms, sometimes preceded by obvious anxiety, but sometimes seeming to come totally out of the blue and to just catapult you into a state of heightened awareness, anxiety, fear, and dread.
Yeah, no, it sounds extremely intense and overwhelming. Have we seen like an increase in anxiety and anxious behaviors in people after the pandemic and all these lockdowns? Do you think there's an increase in the social anxiety that you mentioned?
Oh, certainly. Just simply because we've got out of practice. That we are not doing things regularly that we used to do. And as such, when we return to a situation, it feels more uncertain, it's more unfamiliar, and that brings on the feelings of anxiety. So returning to things that you might previously have done very easily may actually become more difficult.
Of course, I think a lot of people have definitely experienced that. And so, is there a negative stigma around anxiety in today's society?
Yes, undoubtedly. But I think there has been for a long time. It's always been disadvantageous to show others that you might be scared or afraid or worried, as this sort of means that you might be vulnerable, that other people could take the opportunity to mistreat, take advantage of, or manipulate you. And therefore, in adult roles in the world, we like to present to the world that we're confident, we're competent, we know what's going on, we know what's going to happen next, we're in charge of things. And therefore, when you're sitting with anxiety, you also are angry at yourself for potentially showing vulnerability.
Yeah, that makes a lot of sense then. And so, is there a difference between anxiety and stress?
In my opinion, stress is used to describe anything that is likely to have an increased ability to induce anxiety in certain people.
Right. So, does being overstressed lead to anxiety?
Yes, that constantly facing situations that are likely to make you anxious will induce a a persisting sense of uncertainty, and you begin to double guess yourself, and you begin to be able to not let go of ideas once they get stuck in your head.
Right. And so, as we mentioned before, there is like a scale of anxiety, and most people will experience anxiety. Has it become like it's become a very pop culture term to reference your anxiety, or it's just my anxiety, and kind of make a joke out of it? Is this damaging at all in any way?
No, I believe most opportunities to express and acknowledge and discuss anxiety are helpful and healthy. You might be thinking that when people talk of it, they are minimizing it. But I think most people, most decent people do realize how serious and how bad anxiety can feel for people.
Right. And so, when everybody's referencing it, does it take away from the people who experience like severe anxiety if you're experiencing it on like a small scale?
Yeah, that is at risk. I have a bit of a saying that I use with our mental health team, that sometimes the most anxious person in the room is the quietest. Normally, when an average person is anxious, you can tell from their face, from their behavior, from their actions. When someone has lived with entrenched anxiety, they actually begin to mask it. And they may be the quiet one in the room, sitting looking unengaged and blank, but that is because they are so afraid to show vulnerability that they lock out the world as a protection against the thoughts that are running wild in their brain about the bad things that may happen. So I think I don't mind people talking about anxiety, but thinking that the more serious the anxiety, the more you notice it, I think is a real trap. That in my experience, the most serious conditions of anxiety tend to become more silent.
Right. That's actually so interesting. I didn't really even consider that. So, do you think after the pandemic and whilst we're opening up, are you seeing more cases where it's this severe anxiety that goes unnoticed by the public, or is it more just that baseline anxiety with the physical recognition of the anxious?
No, I think a lot of people have had to put their head down and say, I need to push through this. There is nothing else sensible to be done. And they have developed these defenses of appearing blank. And that is going to lead people into to bad sort of self-care and mental habits. And so I think that behavior of trying to tough out and be resistant to anxiety probably has become more common through all of the tribulations and trials of the pandemic.
Mm. And so, what are some physical side effects of anxiety? What are some things that we can look for?
Oh, well, there is the sweating, the tremor, the dry mouth, the physical agitation, the butterflies in the tummy.
Yeah, and so in the more severe cases, is this on a large scale, but without the physical aspects? How would someone as an individual recognize that this is an anxious trait?
Okay, panic disorder is all of those physical symptoms in extreme, intense experience.
Right.
And that's one side of intense anxiety. but there is also the blank side. I will cope with this by showing nothing and showing no vulnerability, and by staying completely quiet and still, and then no one will realize that I'm struggling. So you've got two extremes. One where you get the full-on physical symptoms as an intense episode, but of equal severity and a very different appearance, you have the quietly anxious person.
Right. And just getting your opinion on both those severe scenarios, would one be more dangerous than the other? Obviously, in the panic episodes, other individuals can tell that you're having like this anxious feeling. And is that a way that someone can get help? Whereas like in comparison to the silent and internal overwhelming feeling that people experience, nobody else really knows that they're experiencing it. Is one more dangerous than the other?
Well, I never wish for anyone to experience a panic attack merely as a way of allowing them to ask for help. It is truly a noxious, dreadful experience. People say they feel like they're going to die in the midst of a panic attack. So, yes, if it leads to the opportunity to talk about your experience of anxiety and leads to treatment, that is good, but I can never see anyone having a panic attack as being a good thing.
Yeah.
But at least it is more tangible than the quiet silence of overwhelmed terror.
Definitely. And is there anything we can do to like improve the physical side effects from anxiety, or strategies that can be put in place to kind of reduce that overwhelming feeling?
Okay. In the immediate or short term, removing people from a high stimulus environment, sitting down, behaving in a calm and reassuring manner to them is important. In the longer term, the things that relieve anxiety are emotional connectedness, physical exercise, adequate sleep, and adequate nutrition. All of those allow the brain to respond to challenges more easily.
Yeah, that's so interesting. And so when you're experiencing this severe anxiety, when do you know it's time to go seek help, like from a professional?
I go back to something I said earlier. It's important to self-monitor, and when your anxiety symptoms change how you act or stop you doing things you want to do, or change how you feel about yourself, that your anxiety makes you self-critical or makes you doubt yourself, then if you see that happening to yourself, they're very good reasons to go and seek help.
Yeah. And so if any of the listeners today experience these, why is it so important that they do go seek help?
Again, it goes back to there are sensible, easy, available treatments that do work. There are
And so how do you get help? So how does someone go find these professionals, or is there other ways other than just seeking professional advice?
Professional help is important, but the vast majority of mental health first aid is administered very well by friends and family. So don't think that that helping people with mental health challenges is something mysterious that can only be done by a professional. The basic good practices, should be part of your normal conversation and behaviour in the way that you treat friends and family.
No, that's fantastic news. I guess that's really good. As we're opening up, we're getting to reconnect with those people who can help us get through these tough times. And so if you do think you need professional advice, what if you don't want to admit to yourself? Is there any ways of overcoming, like, I feel like there's some stigma about admitting it, that you're weak or there's something wrong with you. Is there any way to push past these conceived ideas about yourself?
By doing that self-audit. Is it stopping me doing things I want to do? Is it making me do things I normally do well badly? Or is it making me feel bad about myself? And I think you need to ask yourself those questions as an autonomous adult. And if you get the answers, yes, there are things making those changes, then what you do is seek help of one sort or another. And that help can be very wide-ranging. I, of course, really value the contact that you can have with your GP, your general practitioner. But that is only a very small part of what's available. First of all, talking to family and friends and identifying there are things that you don't like about how you're acting or how you're feeling about yourself can be a very good start. I would also point now to the online and telephone resources. They give you a way of having a lot of control of beginning to explore scary feelings. You can remain relatively in control of the process and relatively anonymous, but nonetheless seek high quality information and input.
Definitely, that's so fantastic to know that there's all those resources out there. And would you have any advice for individuals or specifically youth who are in family circumstances or in circumstances where they don't have those friends and family around them? Is there any resources you would recommend to them?
Yes. It's hard when you don't have people around you role modeling good behavior. But I always ask patients, if they're struggling, to think, look at my friends, family, peer group, workmates, and who has some of the same problems but is doing a little bit better than me. And think, what are they doing that makes them feel a little bit better or cope a little bit better than you're coping? It's no good comparing yourself against someone with tremendous resources and who is tremendously able. Sometimes it's better to compare yourself to someone who is like you in lots of ways, but just doing a little bit better, and try and learn from their experience why they're doing just a little bit better than you're doing.
Yeah, definitely. I definitely see how that relatability can be so important for someone. But what if how do you suggest to someone that you think that they may be struggling as a friend? So from the friend's perspective, how do you suggest maybe, hey, you need help, or I think you should go to therapy, or I think you should talk to someone about this? How do you approach that from that side of things?
I think it's really important to not assume that you know what makes others feel good and bad. So just as you look at yourself and say, am I doing things or not doing things in a way that is bad? Am I feeling about myself in a way that is bad, try and look at your friend's experience in that same way and say, are they acting differently? Are they acting in a dangerous or an unhealthy fashion? Are they expressing beliefs about themselves that are unhealthy or negative? And then, if the answer is yes to either of those, then say, how can I help my friend? Now, but this goes back to, they may be afraid of things that you're not afraid of. And that doesn't make it right or wrong. They may be anxious about things that you're not anxious about. And so don't assume you can understand what drives their anxiety. You've got to step back a little bit and say, it obviously is a problem because they're not functioning well. I don't have to understand why it makes them feel bad. I just have to know it makes them feel bad.
No, definitely. And just to kind of wrap up tonight's segment, is there anything that you would like to mention to the listeners about anxiety? Any aspects you think we haven't covered, or anything you'd like to draw importance to, I guess?
Okay. First of all, there are treatments that work that, for the majority of cases of anxiety, structured, skilled talk with a psychologist or counsellor is the mainstay of treatment. And also that anxiety can be very much a trigger for dysfunctional use of alcohol and substances. And that can be another way of assessing your dysfunction. If your anxious feelings are causing you to use alcohol in a way that you know is unhealthy, then that's another marker of dysfunction. And the third thing I'd say is that there are bad treatments for anxiety, and that it is your responsibility to avoid bad treatments, and also very much the responsibility of your counsellors, psychologists and doctors to avoid giving you bad treatment. As a general rule, sedatives or medicines that relieve anxiety have a very limited role in helping people cope better with anxiety. They may be necessary acutely to diffuse a full-on situation, but actually, with medications, suppressing anxiety can be the start of a very complex and dangerous process.
Yeah, definitely. And if anxiety goes on untreated for a long period of time, what are some of like the severe cases looking like?
Undoubtedly, it can terminate in chronic trauma, and it can terminate in significant depression.
No, definitely. So, like, the importance of getting help is just undoubtedly the main key takeaway from this if you are experiencing anxiety, I guess. So I think we may wrap it up there. So thank you so much for your time, Dr. Wright. It's been super interesting to talk to you, and it's been really insightful, and definitely your education is shining through in all your answers. And thank you everyone for tuning into this week's episode. Hopefully we bridged some gaps and answered some unanswered questions for you. And I will pass back to the studio.
Thank you for joining us tonight, and don't forget to like and share this podcast.
Hey, that was fantastic, Molly. You did so well. And Peter, loved your input there. It was really great and very informative. And I'm sure a lot of people that were listening got a lot out of that. What did you think, Julio?
That was really good. Yeah, especially learning about how to deal with your anxiety and the problems that you can face by doing this sort of stuff. There was one question I had in mind, just for older, like the older generation like me, is with anxiety and the issues with that. How do you relate that with alcoholism and the drinking habit, especially now with COVID and the increase in alcohol use that I've noticed as well, especially with some friends I've got?
Oh, absolutely closely related. Alcohol for most people is a short-term solution to anxiety with unacceptable side effects.
Mm.
And one of the unacceptable side effects is that you have to use more and more to get the same benefit. And that is one of the key elements of addiction.
Yeah, for sure. And it was great that Zachary Julio thought that it was very helpful, and I'm sure a lot of people found it very helpful. The content, especially from Dr. Peter Wright and Molly. I thought you were sensational there, leading the podcast.
Thank you, Mark.
Yes,
Really
I felt in good hands. You guided me very gently.
fantastic. And Daniel's made a comment as well here. It's been great to learn all about different types of anxiety and how people help people facing this challenge. So, yeah, well, that's a great comment by you, Daniel. And I thought, Peter, we could sort of start wrapping up this session. You mentioned some really good points that I thought were pretty no-brainers in some ways, how you can be emotionally healthy. And I thought we might put them up on the screen, Julio. I thought they were really good. One was about, good diet or good nutrition. I thought that was a good point, that a reminder that, we are what we eat. And another one I thought you put up there was sleep, getting enough sleep. And we've heard sleep on the show before, but it's so important to have sleep. What were the others? I think you had 3 others, Peter, that you talked about that people should really look at in their lives.
Exercise. Exercise seems to give the brain a rest from anxiety. That when you're out putting full physical effort into a sport or a job, it seems to give the brain some time off to regenerate.
It's great. What were the other 2? One was an emotional thing. What was that one?
And connectedness. Spending quality time with people with whom you share hopes, desires, dreams, purposes is an absolutely necessary human experience.
Absolutely.
What do you reckon about them, Molly?
Yeah, no, super helpful and super good reminders of all the aspects of your life that you've got to keep balanced and keep healthy, I guess.
Very true.
I don't know, Kelly, do you think younger people get those ones pretty easy? Exercise, eating well, friendships. It sounds pretty easy when you're young, like Molly, got heaps of friends, lots of activities. And when you get a bit older, it gets a bit harder.
Yes and no. I think it really touched on it. It doesn't matter what age group, that sometimes young people, they are quite isolated, and online is very different than face-to-face. Another thing that it really got me thinking about is about recognizing people's different 5 love languages. Some people you're like, Peter, yeah, you know what I'm talking about. So if you can identify with those 5 love languages and you recognize a good friend, such as my good friend Julio or Mark, and I can straight away, I know that Mark's love language is quality time, the same as mine. And so that quality time meant, even through lockdown, giving him a call and being like, hey, mate, how's it going? Or let's do this online session together. Or Julio, come around and help me with this IT stuff. And, do you want a cup of tea? We'll start chatting. That's my love language. Whereas others, it may be those acts of service, and that may have been really impacted over COVID times, where someone may be great at, helping fixing someone's car, and they weren't able to actually physically be present, and identifying those love languages and how that can be transferable.
Yeah, great point.
Never assume that what specifically makes you feel good is as important to other people.
Absolutely.
That we all have different ways of showing that we think somebody else is important, and we have different ways of hearing how we're important.
Very true. You're
Pete,
listening,
you
Mark?
do such a great job there at First Step, mate. You've got thousands of clients coming through the door, a lot of them high needs. I mean, how do you cope with that? Must give you a bit of anxiety trying to, give this quality service, so many people coming through your front door.
Oh, it goes back to it's the discipline of trying to stick to the processes, the knowledge, the treatments that are well established. You shouldn't try and reinvent the wheel unless there's a really good reason.
Fantastic. Look, are you going to run us through these 4 points that Dr. Peter Wright from the First Step programs shared with us tonight to help you all with your anxiety?
Yes. Number 1, good diet and good nutrition. Number 2, sleep. 3, exercise. 4, connectedness. I like that one. Number 5, love languages. It's important as well.
Got Kelly's in there. Fantastic.
Can I jump in there and say it's very easy to say connectedness? Some people are really good at connecting, and some people find it harder.
100%.
But I'd identify that connectedness is so important that even if it's not something you're comfortable with or you do naturally, you have to make a conscious effort to find ways to connect effectively. It's so
Peter,
important.
with someone like
that
for
it's worth
an
the effort.
introverted person, how do you think, what advice could you give someone who's introverted, or, like in Molly's aspect, where they may be young and they have that limit of perhaps they can't drive or use public transport? What advice would you give them?
Social media, with all its faults and traps, does allow people who have limited social capacity to find people who share common interests, goals, aspirations, and hopes. And that, if you had to make a defense of social media, that would be one of the things you would say that was really good about it. It allows isolated people to establish contact in a controlled way that was not necessarily available in times before.
No, it's a good point, Peter, and you make also a good point that some of us struggle with those points you made. Some people struggle with connectedness. Milton Wilde thinks I struggle with number 1, which is a good diet and good nutrition. He might be right there. I probably need to focus on that a bit. But what do you think, Julio? Which one would you struggle with?
Out of those ones, probably, I think I do struggle a little bit with love languages. I'm not really that in tune with other people and their needs a lot of the time. So that's one that I'm going to actually concentrate a little bit more deeper on.
Milton,
Peter,
you're 100% right. Ask Mark what he likes to cook, and
I
know his favourite.
I eat too much. Peter, what one do you struggle with?
Connectedness. I'm a fairly stiff, formal sort of person, and I find going into new situations and talking to people I don't know very difficult. And for that reason, I have to look for situations that encourage that, and sometimes I have to be a bit tough with myself and say, put yourself out there.
Good, great point. Molly, which one would you struggle with?
I'd probably say the same as Julio and Peter as well. The love languages and as well as the connectedness. I feel like I can get caught up in myself a bit and be a bit selfish and not really consider what like other people's love languages are, as well as, it's easy to feel hard done by and say I've got no friends, nobody's contacting me, but it's then again flipping around going, well, I haven't contacted anyone else either, and I can't expect it to be one way. So it's also making that effort, as Peter said, with people, sticking my hand up.
Gee, Molly, I'll tell you what, Channel 7 or Channel 9 is going to be ringing you very soon. Kelly, which one would you struggle with?
Sleep.
Sleep.
Yeah, very, very much. And lack thereof. Unable to switch off because want that connectedness, like to be social, like to eat healthy and exercise, but sleep, definitely.
It's very, very interesting show tonight. Looking at all these things that help us with anxiety, and just these simple things, these 5 things, Julio, they seem very simple, but we all struggle with them. And so I think, it's great Peter's reminded us about these things, and Kelly's added on the love languages, which add another dimension, which is fantastic.
Yeah.
Unfortunately, our time's nearly up for the show. Why don't we just go through and just really say what we got out of it, or our last sort of comment for the show? And, for me, I've really thanks being reminded about these 5 things because, I'm a simple guy. I've got 5 things now to focus on. I really think that's going to be good for me. Kelly, what do you think?
Yeah, I think even if they can just take one thing and identify it and to change a habit 21 days. So to think, okay, if I'm going to be exercising or to grow my connectedness, how can I do it? And what can I do to activate that each day?
Great. Julio?
Basically, just think about more anxiety and how it approaches other people, and also the love languages. I think I've got to put my head down and really think about what everybody's feeling and moving forward, especially with my friends and the community I live with. I think that's really important.
Peter, what was your takeout?
Oh, I agree about the love languages. In my life, I have a number of people who are gift givers, and gift giving irritates the bejesus out of me. I don't get it at all, but for some people near and dear to me, it is incredibly important that they give you a gift and that they choose your gift carefully. And I just really have to remind myself to be interested in the process of gift giving, because I could just ignore it. But the other thing is to do that self-audit, to be accountable to yourself. Do I like how I feel at the moment, and how am I responsible for it? And do I like how I'm acting at the moment, and can I change it?
Oh, fantastic. What about Molly May, our youth ambassador for the Big Brothers Big Sisters program? What's your final comment?
Well, Peter just stole my final comment with the self-audit. But no, I
Sorry.
No. Mention it. I just mentioned that it's like a normal thing, and as everyone experiences it on a new scale, and as we're coming out of lockdowns, it is good to do that self-check and, ask yourselves those questions, as Peter said, and just check in on yourself.
Fantastic. Well, thanks for a great show. It's been great having Dr. Peter Wright from the First Step program talking about anxiety tonight, Molly May from the Youth Are Not Alone project and her own podcast tonight about anxiety. Fantastic, Molly. Thanks, Kelly. Good to see you. And Julio, thanks for all your production work, mate, and being there. It's great. Good night, guys.
Good night.
Thanks, everyone.
Thank you.
Thank you for joining us this evening. Tune in every Wednesday evening at 8 p.m. or watch us on YouTube, Facebook, and follow us on LinkedIn and other social media.